Dr. Harrison, a moment of your time? Regarding Mr. Thompson, post-op day 3. His knee flexion is progressing, but his quadriceps activation is still quite poor. I'm concerned about his gait pattern developing compensatory strategies. Also, Mrs. Jenkins from Ward 7, the hip replacement, her pain management seems suboptimal, impacting her early mobilization. We've adjusted her bedside exercises, but she's quite resistant. On a slightly different note, the new referral system for elective joint replacements is causing a backlog in initial assessments. We're often getting patients days after their discharge, which delays crucial early rehab. We've brought this up in the departmental meeting. However, my primary concern today is young Master Lee, the adolescent with the tibial fracture. His adherence to non-weight bearing is inconsistent, and I've noted increased swelling and tenderness, which could indicate delayed union or even compartment syndrome. I've already advised immediate review by the surgical registrar.
Right, Mihira, Master Lee. That's worrying. Have you seen any ecchymosis or neurological deficits? Because if it's compartment syndrome, we'll need to intervene promptly.
Not ecchymosis yet, Dr. Harrison, but the pain described is disproportionate, and there's palpable tension.
Mihira, I am so sorry you have been through such a difficult time, and it is completely normal to feel a bit overwhelmed as you begin your recovery from surgery. Please know that your body has been through a major event, and it is currently working hard to mend itself. As you start this healing process, you may notice some temporary side effects, such as soreness or mild swelling around your incision sites, which are simply signs that your tissues are repairing. It is also quite common to experience feelings of nausea or some changes in your digestive habits as your system adjusts to the postoperative period. For managing any discomfort, paracetamol is generally the recommended option to help you feel more comfortable. It is very important that you avoid taking aspirin or ibuprofen during this initial phase, as these medications can potentially increase your risk of bleeding or cause unnecessary stomach irritation while you are trying to recover. Your comfort and safety are the top priorities right now, so please take things slow, stay hydrated, and give yourself plenty of grace as you regain your strength during these next few days.